It's not a job, it's a way of life. It's so rewarding to work with these families and making a difference and being able to provide these services for families that are so needed.
Welcome back to Finding Common Ground with Heather and Steve. Today we have Kathleen Hayes. She's a program supervisor at the Neighborhood Center, and she focuses on the community-based services at that organization. And she we wanted to talk to her because Steve had met her organization with the foster children that had been in his home. And we realized once we started talking to you that there's a whole bunch of services that are offered at the Neighborhood Center that other people might not be aware of. And there's a couple programs and ideas that if you don't have them in your hometown, this would be a great, inspiration. You'll listen and you'll think, oh, I think we should do that. So I'm so happy you could be here today. Thank you so much.
Thank you, Heather.
Yeah.
Hi, Kathy.
Hi, Steve. How are you?
Good.
Good.
So, Steve, before we hop in with Kathleen, I know you've had a lot of things going on, and I just want to give our audience a quick update, if possible, on some of the, we have mentioned that a film crew keeps showing up at your house because they are filming all these great things that you're doing advocacy-wise. And I think the focus for them is what we do on this show. They're trying to capture those unique ideas that are kind of outside of the box, families in challenging situations that decide they're not going to wait for someone to save them. They're going to try to pull people together in their own community at a local level and figure it out. And you have a couple things that are really coming to fruition right now. And I wasn't sure if you want to share a little tidbit. I know some of it is, hush hush still and not public knowledge, but the things you can tell us.
Yeah, the first one was a program actually started by our OPWDD. They wanted to get more family involvement. They weren't getting a lot of family involvement. I think they've been pressured to get more family involvement and families at the table. And they reached out to Georgetown University, and they decided to interview for several families. I think it was 2 in New York and 1 in Pennsylvania. We had to go through an interview process, and we were chosen. My family was chosen. It was basically one life in a day of somebody who works with disability situations, disabled kids, autism kids, foster kids, cultural situations, because we meet almost every one of those boxes. Mm-hmm. And they were here 2 weeks ago. And they're actually coming back because one of the things that they saw was one of the initiatives we started here locally was a bus that we got for disabled kids. They're coming back and doing a secondary story and filming tomorrow.
That's wonderful. And I love that when you break down those silos and the veterans are part of that initiative that you're speaking about. And sometimes we don't think of that. We don't think of the people who are coming back from a tour of duty. And they might not be ready for employment yet or things like that, but they want to give back. They want to get back into a routine and help people. They have a new mission, right? And so having a husband that served as a Marine right after 9/11, he was one of the first to be deployed to Iraq. I really value that you thought of them, that was part of the equation when you thought, how can I help the disability community? You didn't get stuck in that box, what services come into this silo. You broke out of that and you looked outside into other parts of your community. And you can find the same thing sometimes if you worked with the Office of Aging or, some of the aging population or elders. They too have this world of experience and all these things that they could help with if they had the opportunity. And sometimes it's connecting different groups. You really see a synergy, and I'm so proud of you. This is so exciting. And when we're allowed to tell you guys more, we will. But I'm not surprised, Steve. You've done some great stuff. So, Kathleen, how long have you been at the Neighborhood Center?
So I've been at the Neighborhood Center since October of 2023. I started out as a CPST, so that we use a lot of acronyms, so I'll tell you what that is. So CPST is a Community Psychiatric Supports and Treatment Provider. And I started right after I finished my master's in forensic psychology, and wanted to start working with the kids right away. I did that for about 6 months. I started out working with Steve's kids. So, there was a lot of different ways we worked together. I used a lot of different techniques, working with them, but I also learned a lot from them and from Steve. So, that really got me motivated, got me connected with the neighborhood center. And then I think it was in June of 2024, I got a promotion to be the supervisor of the program. So then I started seeing, identifying where we could expand and provide services in some unique ways. I have an absolutely amazing director, Tina, and I've learned so much from her. She's incredible. And actually everybody at the neighborhood center, I just love it. I actually just came from our admin office because I nominated one of our staff for Employee of the Month and she got it. So we just met over there and she was quite surprised. And it's those things, that you get to see and be a part of that are just so rewarding. But the most rewarding thing is working with the kids. And yeah, that's why I'm continuing. Even as a supervisor, I'm training staff to, work with our youth and the families, doing all the orientation with them, teaching them the different aspects of the 3 services that we provide. I still keep my hands in working with the kids because that keeps me grounded. It reminds me of, what our staff go through and what our families go through and how we can better meet their needs.
Oh, that's great. I'm glad you can do that. And it probably keeps you feeling very connected to the community too. I know when I was doing that type of work, it feels good when you're helping someone.
It really does. And then it gives me, insight as to, what the changing needs are, because needs are always changing, right? Mm-hmm. And we're also, the kids are changing, the dynamics. So it keeps me aware of what I need to be aware of to teach my staff and to pick the right people to, the right staff for the right kids. Just like when I left working with Steve's kids, the day I left, I said to him, I promise you, I'm going to find somebody really good to work with your kids. I promise you. It might take me a month. It might take me, 2 months, but I'm going to put somebody right in there. And I did. I found somebody her name's Anne. She is outstanding. And I took her out there to introduce her to Steve and the kids, and they immediately hit it off. I think you'll agree with that, Steve, right?
Absolutely. What happens is in foster care, they have primary therapists who talk to these kids once a week, usually for an hour or less. And it's geared more towards play therapy, and that's fine, I think, for little ones. But if you have a kid that's been in care way beyond longer than he's supposed to, and they've been going down there for 5 years, they don't want to go down there anymore. Mm-hmm. And Kathy hit it right on the head earlier in the fact that when these kids are traumatized with a CPS pull, why would you have them do therapy in the same building, in the same office, in the same everything that they're originally pulled from their family? I remember when they had a chance to correct that, and I won't mention a provider's name, but they had a chance to correct it because they were buying a new building, and I asked them to please put the therapeutical part of it, all the clinical, somewhere else, or put it in the back of the building with a different door.
Right, that's a great idea.
Now these kids all come in through the same doors where they were pulled, and after a while, when he starts, and it could be when they're 9 years old, it could be 11, and definitely after that, they don't want to go down there anymore. And then the therapy becomes ineffective, and you can't get anything out of these kids. And yet we're the ones that pay the price because they're in our home. We're having all kinds of problems after like a visitation that they would have after having a therapy session down there where they were re-traumatized. And then what happens is I go to court, and then they ask the judge for outside services. Well, unfortunately, they don't like to do that because everything's like self-contained with the services provided by that provider. Fortunately, the judges in our area have listened to me, and they have allowed me to go outside and get services. And that's, it's basically, I would approach Health Homes, which is a subsidiary of that provider, and ask them if they can find outside services. They referred me over to the neighborhood center, and I was extremely fortunate to get Kathy and then Ann. And more importantly, the children in my home who have benefited so much by somebody coming here where they're most comfortable.
Now, Kathleen, do you help with people who are in foster care or adoption situations solely, or do you cover, a wider population? I guess we should start there for the audience.
Okay, so we cover both, and I'll start with my program that I supervise. It's the one I'm most familiar with, so I'll give you some details on that, and then we'll talk about the adoption program that Steve has talked about, and he probably knows a little bit more about that than I do, but it's Kindred Connections, and they work with the adoptive families and foster care and things like that. So my program, again, some more acronyms, CFTSS, that's the Children and Family Treatment and Support Services. And we provide mental health services, behavioral health, and even we provide services for substance use disorders. And our age range goes from 0 to 21. So sometimes people may say, oh, well, how are you going to provide this type of service for a child? Well, we have a child in our program that is young as 2 years old. Mostly what we're doing is we're providing like a clinical or a licensed social worker to do therapy, to work with the parent so that they can work with their child. So they're learning from them. But so the eligibility requirements, ages 0 to 21, they have to have a certain type of insurance. So it's either Medicaid, a Medicaid managed care like Fidelis, or it could be I'm trying to think of the other one, Child Health Plus. Mm-hmm. Okay, so those are the insurances that you would need to have to enroll in the program. And then a mental health diagnosis or a severe behavioral issue. We have 3 different services. So the first one is called OLP, but that's a licensed social worker or a licensed clinical social worker that would go into the home and do therapy with the child or the parent or both. And we're now breaking out into doing group services as well. So we have both individual and group for all 3 of our services.
I love that.
Yeah. We just started that, and it has been a huge success. So it's something I've been, hoping that we would get going since I started for over a year, and it's really taking off. So we have that for the licensed social workers that come in and do the therapy. And then we have CPST, which is the job that I used to do. And that's Community Psychiatric Supports and Treatment Services. And that's somebody who, they work under somebody who has a license. So they're supervised, by a licensed LMSW or LCSW. And they can work on behaviors in the home or in the community, or even push into the school. They can work on behaviors. Let's say a child has ADHD, and there's a lot of disorganization there. They can work on helping them learn organizational skills and teach the parent how to reinforce those skills, or work with the parent to reinforce them. They can also work on communication skills. So if the parent may say, my child is so defiant, I can't do anything with them. The CPST will break down, observe, break down what the issues are, and help, reach that goal of better communication with the child and the family. They also work on, like I said, the defiant behavior. They can work on organizational skills, communication skills. There's just such a range of things they can work on. Emotional regulation as well. So if the child's very angry, they can come up with coping skills, the deep breathing, box breathing, meditation, journaling, any way to rechannel that angry and aggressive feeling and help them learn how to control that. we use a lot of different tools and techniques to teach these skills as well.
I'm curious if people don't live in Utica, if they're not in your, your area, is this a service that's available in other regions? Because I'm a mental health professional and you're talking and I'm thinking, I know a lot of families who would want that. And I just don't know. I'm trying to think if we have something like that. And honest to goodness, I'm not sure. And I'm in Rochester. I mean, we're pretty resource rich. And I don't know if it's just called something different. Everybody has their own name for things. But do you have any idea if this is something that's a widely, something that people do across the state, or is this a neighborhood center thing?
Yeah, so it's actually not just exclusive to the neighborhood center. It's through the Office of Mental Health, and through the neighborhood center, we serve Oneida County and Herkimer County for this program. And I know that we sometimes get, emails or calls from other providers in different counties, and they're like, we really need the service. So I direct them to the Department of Health website. You can go on the Office of Mental Health website. You can go on the Department of Health website. Type in CFTSS, and that's for the Children, Family Treatment and Support Services, and that will bring up a map. I'm pretty sure it's on the Department of Health website. It'll bring up a map, and you can click on your county and find providers in your county that would provide the service, if they do, if it's in the county.
That's wonderful. Thank you.
Yeah.
And when we're writing up the podcast description for the audience, we'll try to include that link just so they have a place where they can say, I wonder if I have anybody nearby me that we could use. And sometimes the families that I've worked with over the years, if I was being provided by the school and there wasn't a copay, that was okay. But if they wanted somebody from the outside that wasn't connected to the school, the out-of-pocket was intense. Most people could not maintain that level of investment, even though they wanted it. They know how invaluable it is, but sometimes with finances, it just makes it really hard. So the fact that you take Medicaid and Child Health Plus and the managed care programs, I'm so grateful for that, because Steve and I also know the reimbursement rates aren't the best, right? Like, some people won't provide for this population. But it makes me think, if you guys are doing it, it's possible. And
Absolutely.
I don't know, Steve, do you think it comes down to how an organization is structured, if they're top heavy or bloated, or if they run clean? Because there has to be something that some places just won't do it. They're like, this is a hassle, we're not going to do it. And places like neighborhood centers making it work. Do you have any insight on that?
No, I just, look, I sometimes try to put myself into somebody else's shoes. If I was an executive director of not neighborhood center, but somewhere else, and I knew that service was needed, I'd probably be looking to see if we could offer it, because it is so needed. And my family's a prime example of why it's so needed. And it's not just, an adoptive kid in my home. It's also, we still have 2 foster kids in our home. We still have an autistic, high needs teen in our home. And the services they provide is the things that we need, that might not work in another provider situation, and they didn't. And it's why we went to the neighborhood center, because we've had really good luck with the programs that we have, that we do work with them. And I'm excited to hear the other things you have, Kathy, because...
Yeah, I just wanted to tell you one other service that we have through our Children and Family Treatment and Support Services, which is the psychosocial rehabilitation. So that's provided mainly in the community. So we will have staff come pick up the kids, take them out into the community. They'll do activities. It's building on their social skills, developing that socialization, and building friendships, appropriate behavior when you're in public. And I don't like to throw that term around, appropriate, but so that acceptable behavior when you're in public around other people. And it's just, that one is a great one. Sometimes people will call it my mentor when my mentor comes, and it's true. The mentor, our staff, they're modeling that behavior for the kids, and so that's our third service that we offer. And now we're doing groups too. So we have the groups going, and I love it because one of my staff, Matt, he had told me the other day how excited he was to be running his group, and he was seeing the kids individually, but now he gets his kids together as a group, and he's going, oh, now I see how they're interacting with other kids their age, and I'm getting a lot of insight. So now I know how to work with them a little bit differently when I'm just doing an individual service with them. So
isn't that so true? Like you can sometimes, especially kids on the spectrum, you get them one-on-one and they love talking to adults, and they're almost, they seem very put together. You take them out of that safe one-on-one with an adult and you put them with peers, and it can fall apart. Like all of a sudden you're like, ooh, that's really dysfunctional. Like that is not helping them when they do that. Yeah. Now I know when we're just the two of us, what we could work on. But the peers teach each other so much too. If they're in a similar situation, I might believe somebody my own age before I believe the person who hasn't gone through it. And that used to be my struggle. I used to think, I haven't experienced some of these things firsthand. I can be compassionate, but having those group sessions, that's really great. Very, very well done.
Yeah, thank you. So we also have our behavioral health clinics, and we have open access hours. The clinics are located in Utica, Rome, and Herkimer. They offer a way for people to get mental health treatment with no appointment at all. And they don't have to be an established patient with one of the clinics that the neighborhood center runs. It's for both children and adults. So the Utica clinic has open hours on Tuesday from 11 to 2, Wednesday from 9 to 10 a.m., and Friday from 8:45 a.m. to 11 a.m. And then the Rome clinic is Mondays from 11 a.m. to 2 p.m., Thursdays 9 a.m. to 11 a.m., and our Herkimer clinic, you do have to call ahead for an appointment. And all of this information is on our website. If you go on there, there's just so many services. But the Herkimer clinic has Monday, Tuesday, Wednesday, and Thursday hours, and they separate out the children's clinic from the adult clinic open hours. So
you don't have to have insurance to go?
So let me just look at
I don't know if I heard you right, because I'm just wondering how you guys keep your doors open. So it's more of a curiosity thing.
So anyone, even if you don't have insurance, you can stop in and you can, make that connection with the clinic, with a clinical provider, and then they work with you. I know that there's sliding fee scales. There's, they don't turn anybody away. And another program that we have that can help people is we have insurance navigators. So our insurance navigators will help people obtain insurance if they don't have any insurance, or if they may, qualify for Medicaid or Child Health Plus. They will walk them right through the process, sign them up, and, give them that access to services that they need.
That's such a wonderful thing. In Rochester, we have an Excelis Resource Center. Excelis is an insurance company, and people kept saying, just go there. And I'm like, I don't even know if I can afford their insurance. I had lost a job, and I went, and to have someone walk you through that and hold your hand and say, this really is based on what your copays have been and the scripts that you need or what doctors you go to. This is the plan that will work for you. It just takes that pressure off that you're going to make the wrong choice. Like when you're already stressed out, you don't need to worry about like, oh my gosh, this insurance plan is going to be terrible, and I'm paying for it or whatever the case may be. So that's very helpful. The one phrase that you and Steve have used, and I just want to make sure our audience understand it, is health home. And we throw around a lot of terms, and not everybody's from New York State. Do either of you feel comfortable explaining to people what that model is, or?
It's supposed to be, I believe, like a transition and a post to help foster kids and people. At least the program that I'm familiar with. I'm not.
I think from institutional settings too. So I think you're right. I think it's when somebody's going from something maybe more restrictive and back into the community. They might be connected with a health home. Sometimes they're connected to the CCOs, right? The care coordination organizations.
Okay. I want to interject for 1 minute just to tell everybody that we have the MCAT services. So that's our mobile crisis assessment team. Very important service. And you can go on our website. they do everything. They've got the bridge script if people are without their medication and no, provider. Sometimes people, they don't have their medication. They need somebody to help them. They do wellness calls. They're available 24/7. And again, they can go on our website. And then the last one I just wanted to mention was the intensive case management for our children. So this is an amazing program, and they can also look that up on our website and see all the services that they can provide the children that are in jeopardy of being placed in a facility. So this is a way to avoid that, to help the family stay together and avoid those crises.
I love all those components, because working in mental health for so long, it is scary to call 911 when your loved one is having a mental health issue, because you are not sure who's going to show up at your house. I know it for me. Even if it's a medical emergency, there's a fire truck in front of my house and 2 ambulances, and then the cop is knocking on the door, and it can be very scary. It can make it a really tense situation more tense. But if you called MCAT and the mobile crisis unit came to you, and you knew that they knew it was mental health, and that they have the skills to approach you in the right way, that's obviously a much better scenario. And I'm sure the outcomes are much better, because I don't want my kid tased. I don't want them in handcuffs. I don't want them mental hygiened because we're having a bad day. I want to figure out what we need to do so we can be in a better place, and we don't have to take those extreme measures, because those are really a last resort. Unfortunately, if the wrong person shows up to help, sometimes things spiral out of control pretty quickly. So, when I was just re-listening to an episode on the way here, Steve, and we were talking about a young man who was turning 21, and you had to get him into a setting. He was leaving foster care, and it blew my mind all over again to hear how sometimes those transitions are so hard, and then the person's kind of hanging there. Even if you had adopted him, you're adopting a whole bunch of the kids that you have had in your home, there's still that era of everything kind of just stops when they turn 21. And then you have an adult child at that point, but they could still have needs, and they still have the trauma of their history, and they still need support. They need more support maybe than the average person, but being adopted in itself, it's its own thing, right? I mean, it's its own kind of trauma, but a beautiful thing at the same time. So I don't think in Rochester we have as many, something like this. So I would love for you guys to explain the Kindred Connections program, because if you hear this, you're in the audience and you think, oh my goodness, that would be perfect for my family or someone that I know or care about, listen carefully and go to the Office of Mental Health or go to your county executive's office and let them know, in Utica, they have this offering, and I wish we had it too.
So the Kindred Connections program is just, it's amazing. And right now we have Angela, she's running the program, and you can go on our website and get the information, make a referral, do your own referral. But the services that are available through the Kindred Connection is they connect, so they have case management, right? And they're connecting families with vital resources, but they're also connecting families with other families. So they're providing each other with support. And they have group get-togethers. They have family fun days where they celebrate holidays and birthdays or have summer picnics. But it's creating those connections with those families to avoid the disintegration of maybe your foster care relationship, the parent and the child, and taking some of that stress off of them. They offer support groups as well. They talk about loss, conflict resolution. We're big at the Neighborhood Center on providing trauma-informed care, right? Because there's so much trauma that can come out of kids that are, placed up for adoption. So a lot of great services and support for the families that not only are adopting children, but also have gained guardianship, whether that's through, the child losing a parent or both parents or grandparents, or maybe it's the grandparents raising them. It could be an aunt or uncle or, a sister-in-law. There's so many different combinations, but it's offering support to anyone who's trying to take care or is taking care of a child that they have, guardianship over or getting guardianship over in some way.
And actually, all the people you were talking about, Kathy, the grandparents, the foster families, the parents, maybe single mom that has got maybe a relative's child living with them, they're all present at these events, and the events are cool. I mean, they go to gyms and game parks, and they went to a swimming hole type situation in one of our parks in Washington Mills, and they all get together. And I even brought a couple of our teens. This particular one wasn't kind of geared towards maybe the teens part of it, because it was more for the younger ones. My kids wanted to go just to socialize and just to see because they know some of these kids, or they know their older siblings. Maybe another foster kid in the family who goes to the same school. And it's
I didn't even think of that too, that, they could have been in a home with some of these kids, and then they went this way, that one went that way, and they always wonder what happened. And when you reconnect that's
it
great.
It happened a couple of days ago. They actually found some kids they hadn't seen in a while, and they're hanging out with them, at the park. And you just don't get that. You don't get that kind of a thing. Post foster care, there's not a lot of things that help a family, whether it's, even if it's bio, whether it's foster, or somebody adopted. There's just not a lot of programs, and they have a program like this through Neighborhood Center is so beneficial to us, but 10 times more beneficial to these kids, because I know the three in our house have benefited from the programs that these guys have there. And three of them are doing one program, two of them are doing another program. And, I wouldn't be surprised if we look into some of your other programs down there for
That's great.
Other kids down the road. So.
I'm thinking of Tristan, Steve, when we had him on. He was one of your foster kids, and he's all grown up. He's a nice young man now, and he said something to me that will always stick. He said, I'm trying to think of the wording, but basically, he didn't want anyone to know he was a foster kid, and he felt like he was the only one, and he didn't want to invite people over at first because he thought he didn't want people to know, he just didn't want them to know that he was different, that his family couldn't take care of him or didn't want to take care of him or whatever. He just didn't want that. That's a big burden to feel like you're the only one in that situation. And then when you go to something like Kindred Connections and you realize there's so many people that are walking a similar path, and then suddenly it feels better. Even if it was still traumatic and it's not what you wanted, you're not the only one, and there is some peace in that. And so I'm so grateful that you guys have it, and I hope that the people listening today are like, that's a wonderful idea, or I'm going to check that website and see if we have anything similar to that in my region, because even being in the field, you're mentioning things I think, oh my gosh, I had people that would have been crucial for. That could have made the defining difference for that family to wrap them around, wrap supports around them in that way. So thank you so much for the good work you're doing. Is there anything else you want to add before we close out the show?
Just that this is a very rewarding job, and it's not a job, it's a way of life. It's so rewarding to work with these families and making a difference and being able to provide these services for families that are so needed. And I'm happy to be here, and thank you for having me today.
Of course. I think the next show, we should talk to your CFO at your organization. I want to know how they do this. I really do want to break it down, because there are some organizations that are doing this right. They are still offering very, very needed services and accepting Medicaid. And whatever your magic formula is, whatever your blueprint is, that's what we need to share with people right now, especially when, funding shifting and people are nervous. And it sounds like your doors are going to be open and you're going to still be offering these things. And I'm so grateful for people like you who choose this line of work. It's a very honorable profession, but it gives you joy too. I can tell that the connections you've made are important to you. So thank you for sharing some of what you do. And I hope that things keep going well for the neighborhood center, because it sounds like you guys are really on a roll.
We are. Thank you so much. Thanks.
Yeah. Until next time.
Continue the conversation by joining our Facebook group. If you're a fan of the show, please join our supporters club. Subscribe on YouTube, rate and review on your favorite listening app, but most of all, share it with your friends. Just one more click or comment can make a huge difference and help us to continue finding common ground.